Good afternoon, everyone. I'm Cindy Gavin, CEO and co-founder of Let's Win Pancreatic Cancer, and it is an honor to kick off this afternoon's webinar on nutrition for pancreatic cancer patients. Thank you all for joining our Let's Learn series. For those of you who are new to Let's Win is the go-to resource for hope and action. And we help provide patients with access to the best treatment options for pancreatic cancer. All of our information is medically vetted, and it is available in both English and Spanish. We have had the honor of partnering with the National Alliance for Hispanic Health for the last few years on this webinar series, and it is my pleasure to introduce my partner, Marcela Gaitan.
Thank you, Cindy. Hello, everyone. Thank you for joining us today in this very important webinar. My name is Marcela Gaitan, and I work at the National Alliance for Hispanic Health. We're a nonprofit public health organization, and we work with a network of community organizations that provide services to over 50 million people around the country. The Alliance works to ensure that health incorporates the best science of culture and community. I'm also the program director for the Nuestras, Voces, Adelante, our Voices Moving Forward network program. This is a CDC-funded program to address tobacco use prevention, as well as cancer prevention and control, and our focus is on Hispanic communities. And for this reason, we've been partnering for Let's Win Pancreatic Cancer to be able to provide the community with information, with accurate and useful information, so it can help them to make informed decisions. So now I have the pleasure of introducing our moderator for today, Juan Pellerano-Rendon, who is a first-generation American Dominican and Colombian descent. He received his degree in advertising, marketing, and sports administration from the University of Miami. Juan has focused his career in the marketing and tech sectors, and he's currently Chief Marketing Officer at Schwab. Before joining Schwab, he was a Group Account Director at Laundry Service, where he has partnered with global brands such as Meta, General Electric, Amazon, and Netflix, among others. Juan is deeply passionate about pancreatic cancer. He joined his mother, Dr. Marta Rendon, on the front lines during her fight against pancreatic cancer that lasted for 4 years. Juan now carries the fight as a member of the board of directors of Let's Win. So Juan, the podium is yours.
Thank you so much, Marcela. I appreciate the warm and lengthy introduction. I didn't realize my bio was so long, so sorry for everyone for putting you through that. But we're very excited to talk today about the role of nutrition and diet that it plays during pancreatic cancer. We know that this is a really hot topic within pancreatic cancer, and we're excited to work with you all and talk with you all about the benefits that and roles that it can play. We obviously know that this disease impacts your digestive tract. We know that nutrition can play a factor in this. So we want to, as we do with Let's Win, provide you with the tools to get you the hope and action that you need. And today we're going to be working with registered dietitian Audrey Caspar-Clark, who will discuss why diet is so important while undergoing pancreatic cancer treatment, explain the importance of enzymes, give recommendations to get the most out of your nutrition. And we, we also have pancreatic survivor and patient advocate Susan Ganis, who will share the lessons of her own treatment and practical tips for staying healthy. So after that, we'll get into a Q&A session where we'll be able to answer the questions in the chat. And I know some folks submitted their questions ahead, so we're excited to get into that section. So if we want to move to the next slide, we know that pancreatic cancer has affected a lot of folks, touched a lot of us on this call, but also prominent folks, as you see here, Congressman John Lewis, Supreme Court Justice Ruth Bader Ginsburg, Alex Trebek, and Aretha Franklin most recently. So this is something that, and even more recently, Quincy Jones, who lost his life just last year to pancreatic cancer. So this is something that is affecting all of us near and far, and increasingly becoming a bigger topic amongst the medical field. So as we look at the factors of pancreatic cancer, about 67,400 were diagnosed with pancreatic each year in the US. The average rate of occurrence is 13.7 in Black Americans, but Black Americans is higher at 16.6%. Now, when we started this, the 5-year survival rate was under 10%, and now we've, I believe, 5%, and now it's at 13%. So I think that stat in particular speaks to the progress that's being made in the medical field and continues to be made, with the emphasis that Let's Win is putting on guiding people to the right treatment options, and also the medical community looking to do more research, which nutrition also plays a factor and role into. We know that the most effective treatment is surgical removal, but oftentimes patients are diagnosed at too advanced of a stage. So there's not easy screening right now. There's a lot of comorbidities. There's a lot of symptoms that come about, but always really important to ask your doctor if you have any family history or could potentially be at risk for pancreatic cancer. So if we go into the next slide, we can talk a little bit about where the location of the pancreas is. And we know that because the pancreas is within the digestive tract, it's a disease of the digestive system. So what that means is you have to go through multiple types of treatment, whether that's chemotherapy, radiation, surgery, and it can cause digestive distress, of course. So there's a lot of factors that can go into as far as symptoms. It could be discomfort of the back, pain, loss of weight, all of which add layers of difficulty to what happens while you're going under treatment, and then also potential symptoms that before you even get diagnosed. So it's really important, knowing that this is a disease within the digestive tract, to stay on top of your nutrition from day one, which is why we're going to be talking about this today. As we go into the next slide, introducing our two co-hosts. First with Audrey Caspar-Clark, who works at an outpatient oncology center as a dietitian at the Hospital of University of Pennsylvania and the Abraham Cancer Clinic Center in Philadelphia, Pennsylvania. She provides nutrition-related education at oncology conferences, patient support groups, community health programs, and hospital staff. And we're super excited to have her here today with us, as well as patient advocate and pancreatic cancer survivor, Susan Ganis. She is a 4-year survivor and knows firsthand of the battle and things to pay attention to within diet and nutrition, and how important that can be as you're going through this. So as I mentioned earlier, we will open up the floor for Q&A at the end, but want to first introduce Audrey, if we could bring her onto the webinar, and just start to talk a little bit about the importance that patients and caregivers also understand the help with nutrition, and talk about what are the challenges within designing a nutrition plan for someone who's going through this. So I'll pass it over to Audrey.
Thank you, Juan. And thank you, everybody, for joining us today. And what I want to say is that, we are all so different. So how one person feels may not resonate with somebody else in terms of symptoms or what works. But what often is a common factor that people notice is that they have this weight loss that's completely unintentional. Sometimes people have gone on a weight loss journey because they wanted to lose weight. They noticed their blood sugars were climbing up, but then that weight loss kind of starts to really accelerate, and they feel full, uncomfortably full. which is not normal for them, and perhaps even pain that radiates around to the back. It may be worse at night after eating. It may be very uncomfortable sleeping. Also, some changes in how their bowels move, and we can talk about that a little bit more. And it is not uncommon for somebody to start to turn yellow, and that's usually the first sign, although it may be that unintentional weight loss that gets you to the doctor or those rising blood sugars. But sometimes it's just so subtle that it takes people by surprise. So we want to make sure that when we're working with an individual, we really build that relationship to understand what is that person experiencing, what has gone on with their health before all of that, and what can we do to get them through whatever treatment it might be. Are they going for some chemotherapy followed by surgery only, or perhaps they're not appropriate for surgery, but we want to really get a plan going, and that's super important. The other thing that I want to emphasize is that it is critical that every patient going through whatever kind of treatment it is feels supported by the team that they have in terms of the oncologist, the surgeon, perhaps a social worker, the advanced practice providers like a nurse practitioner or a PA, and a pharmacist. Pharmacists are incredibly helpful. And the dietitian is part of that team, and we all work together. We communicate on the behalf of that patient. So you, as the patient, have to advocate for yourself. And if we have to pry information out of you and you're reluctant to share that because you don't, maybe you're a little embarrassed or you don't want to bother anybody, or you're somebody who's a minimizer, please put that to rest, put that aside, because we can't help you if we don't know what's going on. So, just real briefly, in terms of side effects of the treatment, some people kind of sort of sail through chemo. I mean, they may be tired. They may notice that their appetite is off a little bit, but other people really struggle. And again, there's that variability. I've noted in my long experience working with cancer patients that women who had a lot of nausea during pregnancy may have a lot of nausea with their chemo. So it's something to be aware of. So when we talk about getting the most out of nutrition, foods to eat, foods to avoid, practical tips, again, this is going to be very, very individual. And you probably will find that you get a lot of advice from other folks, and it's well-meaning advice, and maybe somebody else who has gone through cancer treatment, but for a different kind of cancer. So maybe what worked for them is really not going to work for you at all, but you're trying to be polite, and you don't want to turn away any advice that might be helpful. So that's where working really closely with a dietitian, with your nurse practitioner, your doctor, say what's going on. Because if your favorite food no longer tastes good and people are bringing you big old casseroles with lots of macaroni and cheese, that is probably going to be the saddest day of your life, because you look at that and you can't dig into it the way you want to, and you're afraid you're going to hurt people's feelings. So you got to start where you are right now. Okay. And when we talk about foods to avoid, you don't have to avoid anything in particular. You're just going to stay away from things that don't feel good to you. If you've had a Whipple surgery, yes, there are going to be some things that we don't let you start right in with, including a big bowl of, beans and greens, but we work you towards that. If you are on chemo and you're getting FOLFIRINOX and you have irinotecan in there and you have a couple of the other ones, oxaliplatin, for instance, you're sensitive to cold. Things may not taste right. You may get diarrhea. So we're going to work with you on all of that. So if you don't have a dietitian at your cancer center, if you go on the Let's Win website and into the resources, you will see that there are a few options out there where you can maybe get 1 or 2 sessions at no cost. If you have a diagnosis of diabetes and you're on Medicare, that diagnosis of diabetes on Medicare will get you in to see a dietitian who specializes in diabetes, but they still are very helpful. So I just want you to know that you should ask, and don't assume that you're going to get a dietitian automatically. Ask for everything.
Uh,
Um,
that's great insight, Audrey. I just wanted to touch on kind of one of the things that you said, and obviously the depending on your treatment regimen, depending on whether you're doing surgery, adjuvant, neoadjuvant, um, your treatments plan with a nutritionist is very individual. But I think in terms of general themes, I would say obviously there are lots of fad diets and things, but curious if there are general themes of uh, that you think apply to most pancreatic cancer patients.
So for most pancreatic patients, what they experience is a term we call early satiety, meaning that they feel full more quickly, and also just that appetite just kind of isn't dinging its bell. So what we recommend is putting yourself on a schedule, perhaps eating every 2 to 3 hours, and choosing things that digest more quickly. So
Hmm.
that does tend to mean lower in fiber. We do think that that's really a time to emphasize making sure you get adequate protein, but it doesn't mean that it's no carbohydrates. We're not talking about something like that unless it's completely appropriate. Normally, it isn't. So it's some fruits, some of the lower in fiber vegetables, and sometimes people have a tougher time digesting beef than other types of mammal protein. So fish and poultry often seem to be a good option. Dairy if you're not lactose intolerant, fish if that's something that you like. But those smaller frequent meals, if it's in a liquid form, it may digest a bit more quickly out of your stomach. So using an over-the-counter commercial nutrition drink, or making your own smoothies or soups, those can be helpful as well.
That's great. And I loved what you said about maintaining a schedule to be able to be consistent. I think that's such something that we saw a lot with my mom's treatment, especially with using nutrition shakes and things to kind of supplement your diet. I think can be really beneficial. And then as we get into, the pancreatic enzymes and what role that diet can actually play in terms of nutrition, can we kind of start to unpack that a little bit, since that can
Sure.
also be very individual?
Absolutely. So the pancreas is a very hardworking organ. And we know that it is where insulin is produced, and which is often why people will start to develop some diabetes. But it's also where the digestive enzymes are stored. And so those enzymes are critical in actually breaking down primarily fat and protein. So they're secreted by the pancreas, they go get mixed with the bile, and that sort of emulsifies the stuff that's emptying out of the stomach, which is sort of a soup. And if you don't have adequate digestive enzymes coming in to meet that soupy stuff as it's emptying out of your stomach, or if you have a timing issue, which can happen after a Whipple because of changes to anatomy, you are not going to break down and absorb that food. And the acronym PERT stands for Pancreatic Enzyme Replacement Therapy. And they actually are derived from pigs, similar to how insulin is. They are essential to be taken at the start, basically first bite of every meal, so that they can actually travel along with your food. Otherwise, they won't work. and they can be prohibitively expensive if you have Medicare, depending on whether or not you have met your deductible. Once you have met your deductible, which now is $2,000 annually, the cost goes way down. If you are not on Medicare and you're on private insurance, you can sign up to get either $5 or $10 or even free enzymes. That is sort of a thing that you have to initiate yourself by going online. But the alternative to those enzymes, and the three major brands that you are likely to see out there, is Creon, which is sort of the top of the formulary on most drug plans, but it doesn't mean it's necessarily better. Creon, Pertsy, and Zenpep, and they are all derived from the same porcine-based enzymes, but they come in different strengths. And Pertsy actually has a little bit of bicarb, which sometimes makes it easier to tolerate. You go on the website of these products and you look to see what is available. They all have these patient plans where you can get reduced cost. If you are on Medicare and you are struggling, you must talk to either dietitian or your prescriber and see how they can help you. Sometimes there are ways to get reduced cost enzymes. If you are losing weight and you are having some of these or all of these symptoms that I'm going to mention, and they're a little bit on the gross side, but stinky gas, bloating, stinky bowel movements, possibly they float. You may see an oily sheen in the toilet bowl. The actual bowel movement, the stool may be kind of clay colored or pale in color. Those are, and you're losing weight unintentionally. Those are symptoms of what we call malabsorption, or EPI, which just means exocrine pancreatic insufficiency. And the only way to address this is by taking those enzymes. You can follow a lower fat diet that may help a little bit, but it still means that you're not absorbing those critical nutrients that you need. So I hope that it's a
Yes. No, that
complex,
was a
it's
great
complex.
explanation, Audrey.
Okay.
Yes, I think the range of options too is really important, because I do think people think kind of Creon's the only answer, but there are a lot of other options on the market. So as we think about those different options as far as enzymes, you know, some hospitals may have a nutritionist, some may not, some may have a surgical oncologist and your standard oncologist, some may not. So how can patients and caregivers really find the best way? Of course, Let's Win's a great resource, but what is the most common path for patients and caregivers to find the right one that works for them?
You mean in terms of the enzyme?
In terms of the enzyme, and generally in terms of diet, but I think enzyme in particular, since it's really critical for all patients.
Yeah, so for enzymes, and I will say that not everybody actually needs them, and it may wax and wane in terms of the need for them. So because they are so expensive, I never start somebody on them without actually having, pretty good suspicion they need it. Um,
Hmm.
there are samples available if you are with a comprehensive cancer center. Usually the reps from these various companies, all of the big companies for the enzymes, will usually have some kind of sample program. Ask ask the surgical oncologist if that's who you're working with. Ask your medical oncologist. If you hit a wall on that, Creon, Zenpep, and Pertsy, if you go on their websites, I know Creon actually has, and I'm not trying to promote Creon, please, but they actually have, you could sign up, I think, to have like a patient advocate, who I think is a nurse.
Hmm.
So I mean, I think you just have to beat the door down a little bit on this.
Hmm.
And if you get nowhere with that, there are over the counter versions where what's called the lipase units. The lipase is the enzyme that breaks down fat, is much, much lower. So you have to take a lot more of the capsules. It ends up being
Hmm.
kind of expensive, but you could try it. I mean,
Hmm.
but papaya is not the enzyme I'm talking about. That's not going to
Yeah.
do it. It'll tenderize your meat, but it's not going to break down your fat.
And then certainly there's a lot of people involved beyond the medical team in terms of caregivers. So what are some tips you could also provide in terms of caregivers and how they can best support their family members or loved ones that are impacted by it in terms of diet?
That's a really important question, and something that I'm really glad you brought up, because all of us, whether we're friend, parent, daughters, son, whatever we are, we often show how much we care by feeding people and trying to, you see somebody who's struggling, and we try to come up with the solution as the caregiver. Well, what we have to do is we have to be respectful. We have to listen to the patient and understand that what they are going through is hard for us to relate to, because it's not our experience. So when you're trying to support somebody with eating, offer very small portions, teeny tiny. Think of it like this: you're feeding a toddler, because one of the last things that people have control over is eating. And so when you feel like you have no control over anything else, you can still have that stubborn little, no, I'm not going to eat that. But also know that things don't smell right, don't taste right, don't feel right, aren't comfortable. So offer teeny tiny little things. Don't push, but keep things around. Be a gentle reminder. Eat with that, share a meal with that person. Distraction is incredibly helpful. If you go out to dinner, suggest having an appetizer or two,
Mhm.
small portions. It's okay to start with dessert. It's okay. I mean, really,
Yes.
if a Snickers bar sounds good and you're uncomfortable with the idea of that person who has some blood sugar management stuff and whatnot, it's okay. That person actually needs that energy from whatever they're getting from that Snickers bar. So small portions, um, really listen, understand that sometimes people will push back, patients will push back because they're just tired, and they're just feel like this is one place where they can kind of have a little control. But
Yes.
encourage fluids, if nothing else, fluids first, small things, keep snacks on hand, and be a good distraction.
That's great. Thank you so much, Audrey. I think that's a perfect segue to bring in the patient perspective in terms of Susan's experience as a pancreatic cancer survivor and patient advocate, certainly being her own advocate through her treatment. So, would love to bring her on to the panel. And
Hi,
we'll see you in a
Juan.
bit, Audrey, for the Q&A. Hello. Hey, Susan.
Hi.
Um,
Hi.
Thank you
Happy to
so
be
much for
joining
joining us.
today. Thank you so much for having me.
Of course. So yeah, I think, we talked a lot about the different types of enzymes, the different things that you experience as a patient, but there's nothing like hearing it from someone who's lived through it and come out on the other side successfully. So would love to hear your perspective in terms of, your diagnosis and treatment and of course then as after that kind of how nutrition played a role in that whole journey.
Happy to share my experiences. So, I was one of the unusual cases because I was diagnosed sort of accidentally and early as a stage one patient, which is very unusual. My doctor just happened to be vigilant and caught some unusually highly elevated liver enzymes on routine blood work, and it was during COVID.
Mm.
And I really was not symptomatic other than saying to friends casually, gee, my stomach's been really odd lately, not thinking anything of it. I was functioning perfectly. And she happened to call me and say, are you feeling okay? Because your liver enzymes are very elevated, and started to look into what could have been causing that. She took me off certain medications. My enzymes returned to normal. She kept repeating my blood work. And in the midst of it, I developed a severe case of pancreatitis and wound up in the emergency room,
Wow.
which was not a place you would want to be at the height of COVID.
No, certainly
Um,
not.
no, but that somewhat saved my life because the ER doctor, did tests and discovered that I had a growth that was blocking my bile ducts. And once they were able to treat the pancreatitis, they did a biopsy, which confirmed the diagnosis of pancreatic cancer. It was pretty shocking for me. I was
Mhm.
59 and really was feeling well up until my bout with pancreatitis. I, within 2 weeks, was on the table having Whipple surgery. And then as soon as I was well enough to recover from that, which was about 10 weeks later, I started on a 6-month regimen of Fofluranox, which, as most patients know, it's a pretty aggressive treatment. So I've kind of done it all. And, nutritionally, as far as, what kind of role nutrition played, it was tremendous because having Whipple surgery really completely changes the way that your digestive system works, because they take out so many different things and then they rewire everything. So your digestion really
Mhm.
has to learn to work a completely different way. And, I know for me, my body definitely went into shock, and it took quite a while for my stomach to start really working again in a new way. And I worked very, very closely with a dietitian. I was part of a team at Columbia, and they had a full service team, which I think was really, really important. So I had a dietitian who was very well versed in treating pancreatic cancer patients. And I was given very, very specific dietary guidelines after my surgery. And I remember, the first 2 weeks, I wasn't allowed to have any fiber. I wasn't allowed to have any vegetables unless they were,
Mhm.
skinless, very well cooked. Everything was white. It was an eye-opening for me because I'm a very healthy eater, and it was very difficult for me to transition to eating a completely different way that kind of went against everything that I had done for the last 10 years before that, eating
Of
white
course.
rice and white potatoes and white bread. And I
Yeah.
I looked at her and
Yep.
I said, "What do you mean I can't eat that?" But,
Yeah.
you really have to. And you have to really, I think it's really important to work with somebody who has experience with digestive cancers, because it's really hard to navigate on your own. And I speak to pancreatic cancer patients all the time who are, referred to me for advice. And I always say everybody is different, but you really have to be mindful of eating simply, eating small meals, eating more frequently, and listening to your body. And I think one of the other really important things is to keep a food diary, which I did,
Mhm.
because it makes you cognizant of what foods don't work for you anymore.
Mhm.
So one of the things I discovered relatively early on, maybe not the first few weeks when my diet was so limited, but shortly thereafter, I can't eat red meat anymore. It just, every time I
Mm.
ate it, I had a reaction. And I learned that and I noted that. And, with certain other foods as well, I found that, even though I was always a huge salad and vegetable eater, I couldn't eat all those
Mhm.
things in the same day without having a reaction. I know we talked about enzymes. I didn't need them initially after Whipple, but I found
Yeah.
that once I started chemo, I did need them. So that was
Mhm.
another transition that I made. And recently, actually, I thought that I didn't need them anymore, and I took myself off them. And then I wound up in the hospital recently with pancreatitis.
Oh my
And my
goodness.
dietitian said to me, I think you need to go back on your enzymes, which I did.
Sure.
So, that does wax and wane. As far as um advising somebody who's in treatment now, I would say one of the most important things you can do is to listen to your body and to be in tune with how you're feeling and which foods make you feel better, which foods don't. What you feel like eating may be so different than how you normally eat. I remember that there were days when I was going through chemo where the only thing that I could tolerate was vanilla ice cream, and
Hmm.
I ate vanilla ice cream for the day. Um, People were really kind, and every 2 weeks when I had treatment, they would deliver dinners to my house, and there were a lot of things where I said to my husband, "That's your dinner, but it's not mine." Um, so, you have to do the best you can to keep nutrition going into your body as best you can. And, some days it was shakes, and some days it was vanilla ice cream, and some days it was fish, and some days I couldn't look at it. So,
Hmm.
there's not really a rhyme or reason to what's right as long as you can try to maintain your weight. I was fortunate in the sense that I didn't lose a tremendous amount of weight. I
Hmm.
lost some, maybe 10 pounds, but maintaining your weight keeps you healthy, and it's definitely, what you want to try to achieve. I also found for me that exercising was really important, and whether that
Hmm.
meant going out and taking a walk or jumping on my elliptical once the effects of my chemo were off on day 5, I did that, and I think that that really helped me also. I tried to stay active, and tried to
Good.
keep semblance of a normal life as much as I could.
Yeah, that's a great recommendation. I think definitely helps folks kind of stay mentally focused in terms of beyond the treatment and the disease. So I am curious a little bit, and you talked about how there's no sometimes rhyme or reason in terms of what your body feels comfortable with, but did you feel like at different stages of your treatment you needed different things in terms of your diet? I know you talked a little bit about, during chemo you needed the enzymes, but curious how nutrition kind of flowed through the course of your treatment.
Yeah, particularly at the beginning after Whipple, because Whipple just really, it's a really tough surgery to recover
Hmm.
from. And, you wake up and your stomach is like, what the heck just happened to me? And
Yeah.
it's a long process to come back from that. And, at the beginning, I would have found it really overwhelming to try to navigate on my own what would be better choices than others. And I just found that I really did rely very much on the dietitian, um, to help me with that, because, she was specifically trained in that area. And actually, they put me in touch with her before I even had the surgery so that
Wow.
she could give my family guidance as to what kind of foods to have in the house when I came home from the hospital so that I was better prepared. And that was super helpful too, but it was more of a staged in approach. So, her particular approach was, well, the first 2 weeks, try eliminating these foods and only having these types of foods. And it wasn't a limited list, it was a pretty wide list. And then
Hmm.
it was after that, the next 2 weeks, you can try to add back certain foods. And 2 weeks later, you can
Hmm.
try to add back other foods. And it was really, keeping track too of what triggered my digestive system and what didn't. And sort of a trial and error kind of thing as well, but it was definitely staged over time. And then, once I recovered from that, my dietary needs definitely changed during chemo, because there were certain foods that I
Hmm.
couldn't even look at. I'm a huge fish eater. I couldn't even look at fish during chemo.
Wow.
So, everybody's so different. And I think you just have to take it one day at a time and, see what you wake up thinking about, what you can tolerate that day
Sure.
nutritionally. Yeah.
That's a great word of advice, and I think a great point for us to um, thank you also, Susan, for your candor and sharing a little bit about your journey. It's really helpful and inspiring to hear for all of us, as well as I'm sure all the folks on the call. But I did want to invite back Audrey to join us for the Q&A session. I know there's already been a number of questions that have populated into the chat, so I want to make sure we have a little bit of time to get to all of those. But thank you, Susan. We'll keep you on, and if we could invite Audrey back, that would be great. And we can, hey, and then we can get into the first question. So this is from Janine. She had a question around for Furanox treatment, the steroids really drive up my blood sugar. Are there any dietary recommendations to deal with that? Just go low carb for these days and a few days after stopping the steroids, kind of leaving it open-ended, but probably more so for you, Audrey, that question.
First of all, I just want to thank Susan for what she said, because you perfectly illustrated what I was getting at, and you said it so well. But as far as elevated blood sugars on chemo, people often are getting a little dose of a steroid with the chemo. It's pretty typical, and it has a couple of reasons why it's given. Some of it is to actually help control nausea, but we don't usually ask people to restrict their carbohydrate intake if they're having some elevated blood sugars related to chemo, as long as those blood sugars come back down, and as long as they're not sort of running in the high 200s or anything, upper 200s and higher is something of concern. So if it's just a temporary sort of bounce up from that steroid, it's really important to eat what is agreeable to you. We don't want folks losing weight because they're restricting. I would also discuss it with your oncologist and maybe even the pharmacist to see, if your blood sugars are sort of consistently running a little bit high and then they really jump up, do they want to put you on a medication for diabetes? Do they want you to do anything different in terms of your steroid? But I would not necessarily say go low carb, only protein, unless you really feel like you can eat well enough and you want to get the calories in. It's going to have to be a higher fat, higher protein. And a lot of times when people are on chemo, carbs are kind of what digest easily. And right, Susan's nodding.
Yes.
Yeah. So, I mean, I just, the idea of eating a big old cheeseburger without the bun might sound good to some of you, but when you're on chemo, that's probably not what you want.
No.
So I would really talk that over with your team.
Thank you, Audrey. Going to the next question, I have a question from Matthew. He's two years post-diagnosis with a treatment plan that consisted of chemo, radiation, Whipple surgery, and more chemo. Matthew has been on Creon, but stopped taking Creon with no noticeable change in weight or stool composition. How would Matthew know that he needs to resume Creon or other PERT to maintain proper nutrition and regain some of the lost weight? So another one for Audrey.
So, and like Susan mentioned, sometimes you do need the enzymes and sometimes you don't. So typically the way is there's a real stinky odor, definitely some gas, bloating, possibly those floating stools, pale colored stools. If you're losing weight and you're not having any of those symptoms, maybe it's worth trying the enzymes again. But is there something else going on as well? Maybe you're just not quite eating enough. Usually people know when they need those enzymes. They also often need adjustments in the dosage. So it's not a one size fits all. I hope that answers that, because that's a little bit of a tough one to actually nail down.
I just want to say, in line with that, as far as enzymes go, I found for me, I only need to take them once a day. Some people need to take them with every meal. So it is definitely not a one size fits all. I agree with that.
And Susan, just in your journey in particular, did you feel that there was a certain point in that recovery where you felt your appetite pick up and you were able to, gain weight more readily? I know you mentioned your weight kind of sustained throughout the process, but just curious if there was a point in time that maybe you were able to level out kind of your eating and nutrition.
I would say it was really kind of after chemo, because I didn't have a long period of time between when I was, recovering from Whipple and when I started chemo. It was about 10 weeks. And it really takes about that length of time to even think about, a recovery from Whipple. So I didn't have a lot of time in between. It was like as soon as I started to feel a little more normal from that, I started with, and so I would say it really wasn't until a couple of months after when I felt like things were starting to taste the same and, not have that tinny taste, and food had more appeal for me.
I think that's super helpful to hear too for some of the patients on the line. Next question we have is from Pam. Pam is asking how many units of protease is needed to digest 4 ounces of beef, chicken, or fish.
That really depends on the individual. There is an online dosage calculator on the Let's Win website. I think it may be actually also at I'm not sure, there may be some resources listed that go out to everybody who attended this, but it's really very variable. And I would say that if you're trying to dose your enzymes based on your meal per se, you're probably overcomplicating it. We usually start somebody on a particular dose and look to see how well it controls their symptoms, and then either increase or decrease that dose based on what seems to look like the optimal amount.
Awesome. Next question we have is from Matthew asking what what happens if you're having trouble taking the Creon capsule? What else can we do? I know, Audrey, you mentioned a couple options, and Susan would just also be curious from your perspective of other things that you considered maybe in your treatment journey.
I'm wondering if he's asking that, or mentioning that it's hard to swallow the capsule because right, Susan, they're kind of chunky.
Yeah, they
So,
are.
so what you can do, and if you're having a problem swallowing the capsule, if that's the problem, one is to make sure you're on a dose that that puts you on the least number of capsules that you have to swallow per meal and snack. So the highest dose with the least amount of capsules, and you can very, very carefully open that capsule and mix it very specifically either with apple juice or baby food apricot, or you can ask your doctor, but it needs to be something that is slightly acidic. Um, and then you can mix it into that, and you take it just as you would at the very beginning of the meal, the way you would with your capsule, if that's the problem, the swallowing. If it's something else, whether the Creon's not working for you and you want to try a different brand, you just have to ask your prescriber to write for either Zenpep or Pertsy. Those are the two other major brands, and see whether you do better on them. I'm not sure if Susan had any problems with her, enzyme that she was
I
using.
didn't. I found the Creon worked well for me and was effective, and I didn't have an issue with taking it. I want to say my dosage maybe is 24,000 IUs, if that sounds right.
Mm-hmm. Yes. And we base it on somebody's weight. That's really kind of where we start with the dosing. And like I said, we try to pick the highest dose so that you only have to take 1 or 2 capsules. Sometimes people start on too low of a dose, and then they're swallowing a handful of them, and it's terrible. The other little nuance with enzymes, if you're taking a long time eating, you may need to, and you're taking 2 capsules per meal, you may need to split it up and take 1 at the beginning and 1 part way. Or if you are having dessert, you will need to take 1 with your dessert. because the one that went with your meal is already followed along down into your stomach.
Yeah, that actually feeds perfectly into the next question, Audrey, too. Someone was asking that at a seminar they attended, they had Creon. They recommended that sometimes you take Creon at first bite, mid-meal, and then at the end of a regular size meal. Is that recommended? Also, taking it only with room temperature or cold drinks. Warm drinks break down the capsule too soon. Are is that are some of those things true or necessary, or is it really individual?
I would agree with those with what was mentioned. Definitely, if you drink something too hot with it, you are going to, yeah, you are going to break down that coating. The idea is that it stays intact as it goes down the esophagus, mixes in the stomach, and then is able to start doing its magic when it gets into the small intestine. But if you don't need to necessarily take 3 capsules unless you're really taking a long time with your meal. So that's why I usually mention dessert, because not everybody is eating dessert. And a lot of times when you're going through treatment, your ability to sit and eat a big meal is pretty limited. But those are
That
reasonable. I mean, you know, I would agree with using a cool or room temperature beverage for sure. And if you need to divide up your dose, start at the beginning and maybe midway through, and then don't forget dessert coverage.
I
that's
just
really helpful,
remember
Audrey.
too that my dietitian saying to me, after I was finished with treatment and sort of getting back to normal life, because I would often forget to take them. And she would say, if you've gotten halfway through or toward the end of your meal, it's too late to take them. You really
That's
have to take them at the beginning.
that's
Mhm.
correct. And a lot of times people will take them like a half hour before. Nope. That was a waste too. It's at first bite.
Right.
Um, Thank you for that. Those are great clarifying points. Just wanted to share one, really positive anecdote from Angela about Susan's story. So she said, listening to your story took me down memory lane. Continuing to be careful with nutrition as that remains a priority. Angela had Whipple and did 7.5 months of treatment, and now entered her 9th year of that. So just thank you to Susan for sharing her story and the candor in that process. Just wanted to share that positive sentiment. But last question we have here in terms of nutrition myths and treatment. Are you finding, Audrey, out there that there are myths about nutrition and cancer treatment? And if so, what are the best ways to combat those outside of using resources like Let's Win and talking to your nutritionist?
I think myths are always going to abound, unfortunately. And if something sounds too good to be true, it is too good to be true. Um, Please understand that sometimes people have the very best of intentions when they may tell you about they heard of somebody who cured their cancer following an acid alkaline diet or a keto diet or whatever. And that's anecdotal. That means that's a study of one, right? So we have to use evidence-based research, which is tough in people because we are all individuals. But talk it over with your doctor, talk it over with your dietitian, see what is reasonable. We don't want to do harm, but if you might derive some benefit, then that's reasonable. So, for instance, juicing. I don't have a problem if somebody is juicing because they can't tolerate fiber and they want to get the vitamins and minerals from those fruits and vegetables, but be reasonable because you're not going to get the full nutrient load that you need to sustain you. So you're going to get vitamins, minerals, and a lot of liquid. So, you know, figure out with the dietitian, with the doctor, go with that team. And when you read something and you're curious about it, don't be afraid to ask. but do know that, as we have learned over the years, a lot of what you read on social media has a monetary value attached to it. Somebody is looking to sell you something.
Yeah, that's a really great summary.
I say to patients, who I speak to, that they should get their information from, as Cindy referred to Let's Win, a medically vetted source. And, going on the internet, as we all know, is going down a black hole. And I think you have to be really, really careful as a patient where you're getting your information from. And it has to be a reliable and medically reliable source, such as the Let's Win website. And I direct a lot of patients to that because I know that I have the confidence to know that it's accurate. So,
absolutely. Yeah, and there are some other ones that I really like as well. The American Cancer Society certainly has really good stuff. And PanCan, Let's Win, those are both so great and so helpful. And
Lost Garden also.
oh, yes, very much. So, there are great resources out there, but they all are going to, there's no magic, so everybody's looking for magic, and I don't blame you. We could all use a little fairy dust nowadays.
Yeah.
Yes,
But,
good point.
The good thing is that there are, as you both mentioned, a lot of resources out there that you all noted. So I think we've made the progress, and wanted to just share some final thoughts as we say thank you to Audrey and Susan for joining us today. I think it was a really informative and eye-opening discussion of all the different nuances of nutrition and pancreatic cancer. But wanted to just give a little summary of kind of what we've learned. We know pancreatic cancer is a disease of the digestive tract. So, of course, that's going to cause a lot of nutritional challenges. We want to make sure that, you have the resources through Let's Win to be able to do a lot more research on this topic. As Susan mentioned, all of our information is medically vetted. We publish a lot of learnings from the latest papers, the latest we also have a clinical trial finder, a doctor finder. So a lot of resources and tools on our website that you all can use in addition to the reading that's outlined here below. And we definitely encourage you to sign up to our newsletter. Would also like to thank our partners from the National Alliance for Hispanic Health for joining us today, and all of the questions that came into the chat that helped give us a really enlightening and provocative discussion on this topic. So I will pass it back to Cindy and Marcella, and thank you all so much for joining.
Thank you, Juan.
This was
Thank you.
really terrific. Juan, I want to thank you as our board member for being our amazing moderator. And Audrey, your advice and your wisdom is just so important for this audience. And Susan, your words really, I think, resonate with everybody and comes from the heart. And I really do appreciate all of your support. Just as a reminder again, there are a lot of resources available for patients and for loved ones supporting patients. Please visit the Let's Win site. As everybody mentioned, everything is medically vetted. Everything is in English and Spanish. And, we are here to support you and your families. Marcella, thank you again for being our partner. We are excited for our next webinar, a couple of months away. But thank you again. And I will just turn it over to you to close. Thank you.
Okay, thank you. And I want to echo Cindy and Juan's final words. I mean, it was a great discussion. And again, Audrey and Susan did a great job, as well as Juan moderating the webinar. So I want to thank our partners at Let's Win, and we're so happy that we can continue this partnership, because this information is the type of information that our community needs to learn, what's going on with the nutrition in terms of when the patient suffers from pancreatic cancer. So information that was very useful for everyone. So I just want to announce that our next webinar, just save the date, is going to be October 8th at 2 p.m. Eastern Time, and it's going to address pancreatic cancer genetic risk factors and tumor profiling. So stay tuned for that information, and I want to say thank you to everyone in the participants and the organizers and of course the speakers today. Thank you very much.